Hi everyone. Today we will discuss about dengue. And why are we discussing about it now? The reason is dengue fever has been increasing substantially and a lot of people are getting affected by it. So we want to give you a brief idea about what is it and what if you get it and how to prevent it. First of all, coming to what is dengue. Dengue is nothing but a viral disease caused by flavivirus. It is transmitted by Aedes aegypti mosquito. When this mosquito bites an infected person, the virus enters the mosquito, following which, whenever that particular mosquito bites another person, it keeps spreading to others. Once an infected mosquito bites a person, it usually takes around 3 to 14 days for the incubation period. During this period, there are no symptoms. Once symptom starts, the symptoms can stay for around 1 week. Now coming to what are the symptoms? Most commonest is fever, headache, joint and muscle pains and rashes. Sometimes the joint and muscle pain can be very severe. That is the reason it has been also named as breakbone fever. The course of infection has been divided into three phases, that is febrile, critical and recovery phase. The symptom starts as febrile phase, during which patients can have fever, muscle and joint pain, some may have rashes. But around 5% of people can develop complications like dengue hemorrhagic fever and dengue shock syndrome. Following the febrile phase, most people recover without any complications, but some may develop critical phase, during which plasma can leak from blood into surrounding tissue, leading to fluid collection in chest and abdomen. Rarely, vital organs like liver and brain can get affected, leading to altered liver function tests, altered consciousness, and rarely neurological manifestations like Guillain-Barré syndrome and transosmolysis. The most common thing that happens in dengue is drop in platelet count, that is because of bone marrow suppression. Usually, it starts around 3 to 4 days after the onset of fever and can last for around 5 to 7 days, and the duration varies from person to person. Now coming to what if you get it. First and foremost, if you get any of the symptoms, consult your doctor and he is the best person to decide on your treatment based on your condition and blood reports. Never try to treat yourself. Now we will discuss on what are the tests for dengue infection. Virus nucleic acid detection by PCR is the best method but not commonly available. The other tests are NS1 antigen detection and IgM or IgG antibody detection. NS1 antigen detection is also a good test and has around 90% sensitivity. IgM and IgG tests are antibody tests, so it gives more of a retrospective information of old infection. IgM usually gets positive around 5 to 7 days after an infection and IgG becomes positive around 14 to 21 days after infection. Now coming on to how to prevent it. Best would be to avoid mosquito bite by avoiding going to endemic areas, removing sources of mosquito breeding like stagnant water body, pots, bird baths, or applying or using mosquito repellents. And finally, coming on to whether reinfection is possible. Absolutely yes. Dengue antibodies doesn't give any sort of protection against reinfection. Rather, it can cause more severe symptoms or can lead to more complications during reinfection. Hope this information is beneficial for you. Be safe, be healthy, share and subscribe Way to Health.